Welcome back to KOCT's North County Roundtable. We're talking about COVID-19 and how hospitals are coping. Our next guest is Dr. Jean Ma, Chief Medical Officer for Tri-City Hospital. Dr. Ma, can you give us a description of Tri-City's status with both the vaccine delivery and the hospital bed status?
The fun stuff. I'll start with the vaccine. We are actually one of the sites that actually has ultra cold storage capabilities. What that means is we're capable of receiving direct shipments from Pfizer for that somewhat finicky vaccine that's excellent, but just does require a very secure chain of custody for temperature maintenance. So because of that, we are seeing that we have been able to get direct shipments, which has really helped us to provide our vaccines for the first round of what we were allocated, which was for our staff. As you know, the amount of allocation to the state was really not enough to cover all healthcare workers. And so we were given a certain percentage. Fortunately, because of our ability to take and manage and store that vaccine, we had the option of both and had a little bit more. But what that meant was we were able to get to all of our staff, and at this point, all of our staff that desire the vaccine have received it. We are now looking at everything else that we have. We've been going out to the community and providing all those additional doses that we had from that, really, because we weren't given excess, but we received enough to vaccinate our staff, but a certain percentage didn't want it. So that has now been reallocated for the community of healthcare providers. We've reached out over the last couple of weeks to North County healthcare providers, all in phase 1A, and we've been able to run clinics, including today again. And we are excited because we're now at that place where we're starting to open up to age 75 this week. And next week, we anticipate that this will likely, the county will likely adopt a 65 plus. And we're trying to make sure that we're going to distribute every vaccine that we have. Our goal is to continue to request vaccines, to continue to be a partner in this with our community and distribute every vaccine that we have. We don't want to hold vaccines. We want to be able to get that out. So the campaign has been going really well. We've had a lot of discussions with something called Operation Collaboration, which is under the direction of CAL FIRE, working with our local fire communities and districts to provide vaccines for the general public when their phase comes. But right now, they have been helping focus on healthcare, which is 1A, phase 1A, and now 75 plus, but also they are largely tasked with getting to those long-term care facilities and their residents. So we're working on multiple facets, which include building teams to help those, to help augment that workforce, to work with them in collaboration. We've looked at larger stand-ups that might be more sustainable options here in North County, and some options similar, maybe not to the scale of a Petco, but very similar types of events here in North County. And lastly, we are creating our pod. That's what we've been working on. And our pod is up and running. And as of this coming Monday, our online access through the tricitymed.org, through our COVID page, should be able to allow the general public, so long as they meet the criteria. We just have to stay with the tiers, because it's not just a matter of can we open it, it's can we open it and make sure that we have the supply. We'd love to open it further, but we want to make sure that we're doing it consistent with what the county is requesting that we do, because they're doing this strategically for a very good reason. There's a limitation in supply, which constrains our ability to really expand too fast. So, but we continue to ask for those doses, and it's been a very positive rollout. It's just that we all wish we had more doses to be able to give.
Did I understand you correctly that you are working with CAL FIRE, with the fire department, to administer vaccines to people perhaps outside the hospital in long-term care facilities? Is that one of your strategies?
We're working on multiple strategies into how our goal is as a community hospital to protect the health and wellness of the community we serve. And so that we feel that that's part of our calling. And that is part of it. So I actually was on the phone with them once again today. We met with them yesterday afternoon, their whole team. They're wonderful, very supportive. They're very eager. And their perspective is as many teams as we can put together to help in their current pods that they're doing means that that's just one more team that can either that can more than likely be deployed to their mobile locations, which is their long-term care facilities. So right now,
forgive me for asking, but for the average person, they probably think you need training in order to administer a vaccine. Is it pretty straightforward to train a fireman, for example, to administer a vaccine?
Yeah, that's a really good question. I think that firemen do give intramuscular injections regularly. So this is not a difficult task for experts of their level to provide. So I think that it was very minimal training to get them up and going, and that's what we saw. They're very skilled at providing intramuscular injections. The challenge really more with this is the handling of the vaccine, and that's what we've done too. When we brought in the healthcare community, there's a 15-minute and sometimes 30-minute interval at the end where we're observing people. We use that opportunity to take the experiences that we've learned over a month and help share some of the tips and lessons that we've learned about the best ways to manage the vaccine. For instance, one of the things we learned is if you use a certain type of a needle, and you're very careful to draw up every aspect of the diluent, the saline, and inject that appropriately into the Pfizer vial, it's supposed to only give you 5, but you can get 6. Now, would that raise any concerns that that's not? No, absolutely not. The FDA has approved it for that because once you inject it into that, whether it's 1 or 6 doses that you get out, they're all equivalent. And you're able often to get that 6th precious dose. And for us, in a time when we know that getting vaccines out is so critical, being able to handle that, understand that, draw that appropriately, and get as much as you can out of every vial is so critical. And so those are the kinds of things that we were able to pass on and share, largely with respect to handling and protecting these fragile vaccines.
How many doses altogether have you been able to deliver at this point in time?
We're going on 3,000, I think. I'll have to get another tally, but we're going on about 3,000.
Have you gotten any indication of what you have coming to you in in the next few days, next week, or whatever?
Yeah, I don't know. We often find that out week by week. I anticipate we're going to see an additional 1,000 next week. But we've requested those doses because our goal is for our pod here at Tri-City to be able to get 500 to 1,000 doses out per day. That's what we requested for our pod. And so hopefully we'll anticipate getting that amount for our next clinic.
Do you have any kind of insight into what might have been the problem with the people who had a negative reaction to the vaccine in Petco Park? Is that something that your colleagues have talked about and are on the lookout for?
Yeah, that was obviously very concerning. My colleagues did share with all of us collectively as a chief medical officer community right away when that occurred. And that actually helped us make sure that none of us had that lot immediately. But the county was very quick to react to that also. I saw that Dr. Pan and the state epidemiology team felt that there was it really wasn't statistically out of the norm, and so it has been released to go back into use. All I can say is, from our perspective, we haven't seen any issues with Moderna. We've used a fair number of Moderna, and we have not had any problems with that. It's a bit of a puzzle, but I'm not aware of any other issues with that lot. So statistically speaking, yes, there are going to be allergic reactions. So at this point, so long as it's been vetted and there weren't very unusual reactions, besides what we tend to expect is that there's going to be a certain percentage of people that have allergic reactions. I think we're all comfortable with the fact that we're just going to continue to monitor people very closely. When people do identify a risk of severe allergic reactions, or one way to really identify it is, have you ever been prescribed an epinephrine pen? That tells me that your doctor or your healthcare provider has identified that you do have severe allergic symptoms. And that's a good way for us to identify that individuals that we recommend that they stay with us for 30 minutes. Knock on wood, we have not seen a severe allergic reaction yet here, but we do know that this is a possibility with these vaccines.
Can you give us a probability? Because I think many people that's one of the things they're afraid of, but actually the probability is what? It's small, right? What, 0.1%, 1 in 1,000, what would you say?
Well, the overall probability of an allergic reaction with any medication you're looking at is about 3%. If you took all comers and you gave them any medication, you're looking at a 3% population is going to have some type of allergic reaction. That's why I'm not seeing numbers that make me say, wow, that could be an allergic reaction to any medication that you take. If there was a consistent pattern, that would be different, but I haven't seen that yet.
Thank you.
In terms of your hospital and the delivery of resources for non-COVID patients, how badly impacted are you right now?
I hesitate to take a deep breath and say, we're seeing a little bit of a drop this week. It is the first drop that we have seen in months since before Thanksgiving.
This is a first drop in COVID patients, you mean?
Yes, in COVID patients. And so that ultimately translates into the availability of space for non-COVID patients. So we're seeing a little bit of a downtrend throughout the county right now. We're hopeful that we're not going to see another surge. I think, again, now's not the time to take our foot off the gas and to be particularly careful in our communities, because we still know that community spread rate is very, very high. The vaccine is here, and as we continue to get that out, we're going to see that protection transferred across a larger swath of the population. But we're not there yet. So I think that we certainly are imploring that people do their best to maintain the things that we've learned to do over this last year, because we're almost there. But the difference this time is all of us know that after July, we had a downturn and we created more capacity again. What's happened is we've seen a surge upon a surge upon a surge, and patients with COVID stay for long periods of time. And as a result, you don't have that reserve anymore. None of the facilities have the reserve to be able to absorb another surge. That would be catastrophic at this point. So while we're seeing a little bit of a downturn, none of us are ready to declare victory yet, not by a long margin. So I don't want to be negative and be pessimistic about it, because I think there's a lot of reason to be optimistic right now. I really do. There's a lot of reason to be optimistic. There's a lot of really good things happening that we're seeing, but it does require all of us to continue those efforts. So now, again, that does mean we are having a little bit more capacity. And although most of us are restricting surgery still, we're restricting elective things that maybe can be pushed off a few months. But there are a lot of things that, people describe as more time essential. They may be closer, sometimes described as elective, but when somebody is not able to walk and lives in severe pain, that's not particularly elective for that individual. If it's a cancer screening, that individual may not see that, may not necessarily define that as an elective procedure either. And at some point, we're going on a year now. So at some point, people are wondering, when can I get this done? I'm starting to get particularly concerned or very symptomatic. So the capacity is starting to open, but it is still somewhat restricted.
Is it true to say you're sending some of the people who have been in your hospital for COVID and who've recovered, sending them home sooner than you might otherwise have sent them because you need the beds.
Yeah, I think that we're looking at every option that we can. At the end of the day, it has to be a safe option. And so let me give you an example. We're using home oxygen a lot more than we would have in the past. In the past, we would just bring them in the hospital, observe them for a few days, and if that necessary, send them home with home oxygen or let them recover. And many of these patients with COVID, they don't have all these other issues at the same time. Now they can develop complications, absolutely. But there's a certain percentage of patients that have this borderline oxygen saturation or oxygen level where they could probably do okay at home, but probably isn't usually good enough. And so what we're doing is sending them home if they qualify for oxygen. And we've also purchased oxygen pulse oximeters. Mm-hmm. And these little oxygen devices, which you can even buy on Amazon, we purchased and we give to our patients because we want them to know when they're going to get in trouble, not just symptomatically, because it's very hard. People with COVID often feel like they're short of breath, but they don't know, do I need to come in or not? And we often see a lot of people, you get to this point where you get short of breath and short of breath and short of breath, and you think, I'm just been this way. But you get to this point where you just kind of fall off the curve and you don't even realize your oxygen levels are critically low. But you have no way of really knowing that. You just know that you've been short of breath and you think it's just part of the whole process. At what point do you seek care? And so sending people home with a pulse oximeter gives them the ability to let us know, check in, or come back if they're going below parameters that start to make us a little bit more concerned. But that's a way that we can make it safe. They have to be reliable. They have to be capable of doing this. We prefer that they have somebody helping them. That, in conjunction sometimes with oxygen if necessary, is a good way of taking some patients that otherwise we could preserve those really valuable resources, which is our beds for the most critically ill, and some of these that we previously might have admitted, we can really send them home in a fashion that's very safe and bring them back when it's really necessary.
Thank you very much for speaking with us today, Dr. Ma.